Hello, everyone, and welcome to Chats with Your Advocate, where health literacy meets real life. I'm Tiffany James, family nurse practitioner, board-certified patient advocate, and owner and founder of Divine Wellness Partners. Divine Wellness Partners is a medical, advocacy, and health navigation practice. So these chats are all about bringing information into real conversations that can help you feel more confident and informed on your medical journey. Before we begin, as usual, a quick disclaimer. This chat is for educational and awareness purposes only. It does not replace medical advice, and it does not create a patient-provider relationship. So always seek guidance from your treating provider and care team before making any changes to your treatment routine. Okay, great. Now, what are we talking about? We're talking about a condition called IIH, or Idiopathic Intracranial Hypertension. Simply put, it means increased pressure around the brain without a clear cause. Now, you may also hear this referred to by other names. In the past, they called it Benign Intracranial Hypertension or Pseudotumor Cerebri. Those terms aren't used as much anymore and can be misleading, to be honest, because this condition is certainly not benign. And yes, with the pseudotumor, that name is used because it can mimic signs of a brain tumor. So some people will have things like severe headaches, vision changes, and ringing in the ears. But currently, IIH is the preferred term. So the pressure on the brain can damage the optic nerve. And if left untreated, it may lead to vision loss. So that's why awareness is so important. So who does this condition affect? Now, it's considered a rare condition, and it is. Only about 1 in 100,000 people within the general population have this condition. Prevalence is higher in women, around age 20 to 40. Most are overweight, but not all. But when we're talking about women specifically, that number increases to about 20 in 100,000. Keep in mind, men and children can also be affected, so this is not limited to just one group. So, again, awareness is really important and it matters for everyone. When we're talking about symptoms and daily life impact, the hallmark symptom is a chronic pressure-type headache, often daily, persistent, and very difficult to treat. There are other symptoms that can occur, vision changes, so things like blurry vision, double vision, and for some people with high pressures, temporary vision loss. You can get ringing of the ears, something called pulsatile tinnitus, which mimics that of a heartbeat. Dizziness, nausea, and fatigue are some other symptoms. Now think about living with those daily symptoms. It can affect your ability to work, study, or even enjoy time with family and friends. And because people with IIH often look fine on the outside, their struggles often go unnoticed. So without proper recognition, those serious complications like vision loss and quality of life impact aren't addressed. So when looking at diagnosis, they usually start with an eye exam. Not always, but looking at the eye, they can see something called papilledema or swelling around the optic nerve. And from there, they may order imaging to rule out other causes that could be causing increased pressure, and a lumbar puncture to measure cerebrospinal fluid pressure. Some treatment options would include things like medication. One commonly used is acetazolamide. Weight loss for those overweight, and severe symptoms may require surgery using a shunt or optic nerve procedure. However, some of these treatments can bring their own challenges and hurdles like medication side effects, recovery and monitoring after surgery, or just the stress of trying to adapt to the new normal. It can really cause issues with quality of life and daily functioning. So the key takeaway here, prompt diagnosis and treatment, getting those ongoing eye exams and protecting the vision, and talking about it, because those who are dealing with this condition need to try to cope. And just keeping in mind that rare conditions like IIH are often overlooked. People are being told that their symptoms are just migraines or stress-induced, and it may take multiple providers, multiple visits before that diagnosis is made. So that's where advocacy comes in, both for yourself and those within your support systems, because being informed, asking the right questions, speaking up when something doesn't feel right, those are the most powerful tools. So when providers and patients are aware, fewer people fall through the cracks. Interventions can be put in place. Improved quality of life can be obtained, and vision can be protected. So if you are interested in learning more about what you're hearing today, as usual, I do post references in the YouTube description. And again, these chats are just designed to start the beginning of your journey. My hope is that you will take what you've learned today. If you're interested in this, or you're like this is affecting you or affecting a loved one, empower yourself. Keep researching. Keep asking questions. Keep advocating. That's what it's going to take. So thank you so much for joining me today. As usual, be sure to follow Divine Wellness Partners for more chats with your advocate. And until next time, take care.